Welcome to the Emerging Litigation Podcast, a co-production of HB Litigation, Critical Legal Content, Law Street Media, and Fastcase. I'm your host, Tom Hagy. This podcast is based on an article published in the Journal on Emerging Issues in Litigation. Our guests wrote in that piece, titled Government Involvement in Medical Care, How Far is Too Far? In it they wrote, Science and medicine have come a long way since the early 1900s. Well, I hope so. In fact, medical advancements in the past 5 to 10 years have been extraordinary. Breakthroughs in technologies, our knowledge of diseases and mutations, and advancements in treatment options have been remarkable and have drastically reduced the fatality rates of many outbreaks. However, regardless of medical achievements, rapid changes in any field open the door to renewed debates over different laws and rights that protect those involved. It just so happens that medicine is innately tied to an individual's body and choice. Or they go on to ask, what's an individual's personal health decision have to do with the courts or government officials? Personal health care decisions are usually upheld unless harm to the communities at stake. In addition, every individual has a choice as to where they want to be treated, which physician they want to be treated by. Therefore, it's easy to think that personal health care decision-making is protected, but could this right ever be encroached upon? They say the answer relies on current cases that are being presented, what laws the courts are upholding and or creating with their new rulings. Although legislation could be created and new federal statutes enacted, ultimately every decision has certain inalienable rights. The importance of how the courts construe these rights and how much weight they bear ultimately determines whether an individual's personal health decision will succumb to government interference. Yeah, they wrote that, and a bunch of other things. We'll put a link to the article so you can grab it. How much authority do government agencies or even the judiciary have over healthcare decisions of individuals? It's been hotly contested, especially in recent years, given the emergence of the COVID-19 pandemic. Individuals often assume the practice of medicine and the enactment and enforcement of laws are separate and independent enterprises, that they remain fixed in their respective corners. However, when we dive deeper into this issue and look at history and precedent, it's evident that the rights of individuals versus mandates of government in respect to healthcare has been going on for some time and will continue for years to come. The coronavirus pandemic is just the latest health issue to raise the question of government's involvement, or some would say interference, in individuals' control over their own health care and medical treatment. But don't take my word for it. Listen to my guests, Cian and Bryce McColskey, two healthcare professional liability attorneys, as they discuss the intersection of law and medicine with a review of medical mandates, the impact of advancement in science and medicine, and where the role of government to protect public health intersects or collides with personal healthcare choices. Sandy and Bryce are both with the law firm Hall Booth Smith. Sandy's practice primarily focuses on medical malpractice and defending hospitals, healthcare institutions, physicians, nurses, and institutional employees in medical malpractice actions from inception through trial. She's also chair of the firm's coronavirus task force. She practices out of the firm's Atlanta office. Bryce McColskey is an associate in the Jacksonville office of Hall Booth Smith, and he too focuses on medical malpractice, professional liability, and general liability matters. I want to mention too that Sandy is on the editorial board of advisors for the Journal on Emerging Issues in Litigation. She's been a frequent contributor to that and to this podcast, and we appreciate it. And of course, I'd be remiss if I didn't mention too that, we're talking about medical decisions made by the government and government involvement. We did talk a bit about the Dobbs decision from the Supreme Court, the abortion ruling on overturning Roe versus Wade. While there are some distinctions, it's obviously relevant in this discussion. So we'll touch on that a bit too, just because it's so sensitive. And with that, here's my interview with Bryce McColskey and Sandy Cian with Hall Booth Smith. Sandy Cian and Bryce McColskey, thank you very much for doing this today. In your article in the Journal on Emerging Issues in Litigation, you discussed an important precedent involving the smallpox vaccine. It's a pretty old precedent, but what can you tell us about it?
Yeah, so the Jacobson v. Commonwealth of Massachusetts, you would think a case all the way back from 1900s would have no bearing on any decisions nowadays. But it is about a smallpox vaccine. And what did we just get out of, or we're still kind of in it? Who knows? Is the COVID pandemic. And we were talking about vaccinations there. And we have some other issues that are, here in modern day United States. But in Jacobson v. Commonwealth, you had the state statute was enacted that required individuals to receive a vaccination against smallpox to protect their safety, their well-being. Well, an individual, he had an issue with that. He thought his rights were being infringed upon, and he didn't want to take the vaccination. But the Board of Health in Massachusetts actually adopted a regulation that conveyed powers to specific physicians to enforce the smallpox vaccination. Well, this individual, he did not want anything to have with it, argued his constitutional freedom was infringed upon. However, what happened was the courts ruled that the state police powers held, and it was the greater good, the greater public safety to ensure health and public safety of their individuals, that they would enforce the mandatory vaccination. And this kind of sounds similar nowadays with, the COVID pandemic and the vaccinations, and people not wanting to get vaccinations. They thought that, they have the right to choose. And then we look back at this case back in 1900s, and it still has striking similarities to this day. And that's kind of where we're at now is are we going to be looking at state police power, enforcing vaccinations, choice on health, what an individual can or cannot do with their own body? And that's why we wanted to take a deeper dive into this issue here.
Yeah, gotcha. How's smallpox doing these days? It's pretty much gone, isn't it? Or is this one of the ones that you hear it pops up once in a while?
I think this is the one that you hear pops up
every
once in a while, just like polio,
and cholera.
And measles. Measles, that's the other one. Measles.
Oh, okay. All these years later, how does the Jacobson case hold up, and how does it translate into today's vaccine law landscape?
Yeah, so I think it's interesting because if we're looking at it from the perspective of the COVID-19 vaccine mandate, you have to look at it from what the arguments actually are. So the argument in favor of allowing a government body to issue these kinds of mandates and mandate folks to, receive these vaccines, it's for the general health and welfare of the public. In contrast to that, we have the opposing argument now where it's infringing upon people's due process rights and their immunities and privileges. I think now what we're seeing is it really depends on what state you're in. It is obviously going to have a huge effect on whether or not a state will be able to issue these, sweeping mandates for all individuals, or whether or not they are to do this in a more specific capacity. For example, only requiring healthcare workers to have these kinds of vaccines because they're interacting with the community in a way that obviously affects people with compromised immune systems and so on and so forth. I think it's interesting because this is not a new issue. It is definitely an issue that kind of pops up every flu season, for example. And whether or not we can force people to get the flu vaccine is something that states grapple with every year. So I think right now it really depends upon where you come down on the argument. And we were following a case for purposes of the COVID-19 task force, which I know, Tom, you know, and I think I've talked about on this podcast previously, that my office has been pretty involved in. We've been following cases with respect to whether or not these mandates are going to hold up after employees are terminated for purposes of violating vaccine mandates that are issued by the state. So the one that we saw recently pop up on our sort of quote unquote news feed is this case in New York where the state had issued a vaccine mandate for state employees, which included sanitation workers. And these particular sanitation workers were terminated for failing to comply with the mandate. They turned around and obviously filed a lawsuit saying that their rights were violated and that they were, obviously injured because they were not receiving compensation anymore. Interestingly, recently, the judge in New York had found that the vaccine requirement for these particular sanitation workers violated the New York Constitution separation of powers doctrine, and that it was arbitrary and capricious and violated the fired workers' equal protection and due process rights. So I think we're seeing, from the perspective of COVID-19, I think we're going to start to see a little bit of a domino effect coming out from cases like that, and people making these arguments that it does violate their equal protection under the law. So.
Well, it seems like with so many things, it's not black and white. There's always looking for some balance. I think that in the case when the mandates were coming down, I mean, it was like every day we were seeing 500,000 dead, 700,000 dead. Are we going to hit 1 million dead? So there's also a lot of like, well, is this going to wipe us off the planet? So it seems like in a situation like that, yeah, you'd want the government to say, okay, everybody take your shots, get your shots. And then you can see it from the individual's perspective. It's like, hey, it's my body. I think that healthcare workers in particular were in a very weird spot. I mean, they know how well medicine works. They're completely exposed to all these people who obviously have the disease, and yet they didn't want to have the shots. I mean, and plus they were working themselves, to death. And so that's why there's so many openings, obviously, in hospitals for nurses, because they just burned out. But it just does seem like at some point, it's not that much of a risk. We won't force people, but now everybody's expiring or getting the disease. Let's force it. Talked in the article about how personal healthcare decisions are usually upheld unless there's harm to the community. And that's what you were just talking about.
Well, Tom, I was about to jump in here and
please do, Bryce.
Help you out before we move on to that next prompt. You make a good point, though, when we talk about individuals as opposed to employers, and how healthcare professionals we're in that kind of odd oasis, Bermuda Triangle of what's kind of going on. Vaccinations. Are we mandated to get the vaccine because we're working with patients that oftentimes have pre-existing conditions that leave them at higher risks to develop long COVID, as it's been phrased, or certain worse effects that COVID could bear. Some of the case law that we read, especially case Biden v. Missouri, it noted that the secretary actually mandated that healthcare workers partaking in medical facilities would have to get the COVID vaccine. It was a mandate, and although it was noted that this was kind of outside the reach of the secretary's power, one of the reasonings behind the mandate and upholding the mandate was that healthcare workers already get numerous vaccinations to help with patients and to make sure that they're not transmitting this disease or to the next patient. So they're kind of used to that already. So that was kind of how they kind of upheld and supported their decision in mandating healthcare professionals to get this mandated COVID vaccination. However, as you stated and how we've talked about individuals, we don't have this day to day where we have to have a vaccine, because we're dealing with high risk individuals. But it leaves that thought up here. We never know who we're interacting with next to each other. COVID was so transmittable that, if you didn't have the vaccine, or if you did, you never know who you're around with their high risk, with their pre-existing conditions. So it definitely leaves that door open going forward on the next pandemic. Hopefully not another pandemic, but the next transmittable disease. How are we going to tackle that?
So what kind of litigation are you seeing out there in this context?
So I think we just covered some of the stuff that's going on right now with respect to the vaccine mandates. Some of the other items that we were seeing just within the past year or so is families of patients filing petitions in courts to direct the medical care of a loved one. Again, we saw this in the context of COVID-19 with a loved one not doing well in the hospital and probably on a ventilator or something like this, and the family knew of an experimental treatment, or I don't know what you would call the ivermectin craze, but
yeah.
But
I know what you mean.
I wouldn't call that experimental. But yeah, so we saw this, and I think Bryce is in our Jacksonville office. I think he had been involved, or his office had been involved in some of that litigation with respect to family trying to compel medical providers to administer ivermectin to a loved one. who had a low chance of survival on event with COVID-19. It's just interesting because I think, to what end do we allow now not just the individual self to have autonomy over their body, but also now do we have family members dictating what medical decisions we make for others and getting some kind of relief through the court system that way? That's another thing that we're seeing with respect to that.
I think you made a good point that you are seeing this now as we progress out of COVID. Thankfully, fortunately, we're starting to see not necessarily vaccination mandates, but now what about treating from families? Are families trying to get this? And it's not necessarily dictated to just COVID or specific to COVID. You see this in other aspects of care and whatever healthcare provider is providing to family members. Can you give them a certain drug? Can you give them a certain medication or therapy to help them through this? And what do courts typically rely upon? How are they going to see this? Are they going to mandate that, hey, this physician, this healthcare provider needs to administer this specific treatment to this patient because the family members are saying so? We've seen over time and time again, as of late, that courts typically stay away from, practicing medicine from the bench or medicating from the bench, as they say. So they try to withhold ordering physicians and mandating physicians to administer certain medication and try to treat a type of patient a certain type of way. That's kind of what we're seeing, but that was a good point on how nowadays, you see family members that are, they're adamant. They don't want to lose a loved one. They want their loved one to be cared for and to get healthy and well, and that's what everybody wants. But then you kind of hit that gray area where it's like, who's really going to say what? Who's going to mandate it?
Well, of course, then let's get to the big elephant in the room, the one that we didn't address so much in the article. And of course, I'm talking about kitty litter in schools. I don't know if you guys have opinions. Can it be forced? Comes to government involvement in medical decisions, there isn't anything bigger than the Supreme Court's Dobbs decision, which obviously overturned Roe versus Wade. It's thrown the issue back to the states, and a handful just amended their constitutions to make it a woman's expressed right to have autonomy over her body. And so other states are enacting increasingly strict bans. Some states had what you call trigger laws. As soon as Roe was overturned, these laws went into effect. And some of them are even, and I haven't done a full survey, but there's talk about even if the life of the mother is at stake, or if she's a victim of rape or incest or something like that, that this woman still may not have the right to an abortion. How might that decision impact the role of government in making healthcare decisions in other types of situations, if any, or do you think it's just going to be restricted to women's right to have an abortion?
We're going to now have states basically deciding whether or not a woman has the right to choose what she wants to do with her reproductive rights. Contrast that with the arguments that we've been seeing now on these vaccine mandates. Now, we can't force people to have an abortion, right? And we're not doing that in that sense because for obvious reasons, but just bear with me on my logic here. Mm-hmm. Contrast that with what we've been saying, people filing complaints against employers for vaccine mandates. And so if you don't want your employer or the state, because these were state mandates, vaccine mandates, we don't want people interfering with that individual right. But at the same time, we're now having this conversation where we're allowing the states or federal government, any municipality, right, have a say in women's healthcare. Let's just put it there generally. Mm-hmm. How do we reconcile those two issues? And I think what we've been talking about today, it's going to be one of those issues where how do we draw parallels or how do we differentiate this issue of these vaccine mandates or medicating from the bench, like Bryce had said earlier. I think we have to reconcile the fact that we're going to be grappling with these arguments that fly in the face of one another, right? So the government is allowed to dictate what women do in terms of their physical health, but at the same time, we don't want government telling us what to do with our physical health.
Well, the obvious thing here is that the difference here would be that people who are against abortion will say, yeah, that's fine that the woman gets to choose, but the baby, the fetus, the embryo, whatever, it has the right to not have procedure imposed on it. So people have the right to oversee treatment, make medical decisions for their children, but they don't get to put them to death, which is what the anti-abortion folks.
Then you have another argument, right? And then you have the pro-choice folks saying, well, a fetus is technically not a viable human yet. So they can't survive outside of the female, and therefore they don't really get a choice. It is the choice of the mother. So
yeah, and that's where the argument just kind of bounces back and forth, because then the anti-abortion will say, well, why is viability the still a life?
You look at our article and you look at the current issues that we face nowadays, especially as we're talking about the abortion, how quickly things can change, how things can change from a court outlook, what the law says. And you looked at the Jacobson case early on, and they pointed to the state police power. Well, we're seeing here now with, COVID, abortion issues. I mean, you're seeing still that state police power. What particular state is mandating the certain rights, what an individual can do. But then the courts, as we talked about, they typically try to stay away from medicating from the bench, staying away from enforcing medical decisions. But, as we see nowadays, I mean, it can quickly change. So I think it's something to be aware of as lawyers that practice in the medical field, but also for individuals, just to be aware of the court's rulings when it comes to individual personalized health decisions, because it can quickly turn around, and we see it nowadays, like we've been talking about.
I think it's interesting because if we really draw it back to what we discuss in the article, and with respect to the arguments made with respect to medical decisions, treatment, vaccines, and the like. And I think it's going to be just really interesting to see how those cases are going to interplay with the cases that are coming up under Dobbs. I really think it, and there's case law on both sides. So it's just going to be really interesting to see how everything sort of shakes out. I just truly believe that the litigation piece of this conversation is really going to be the interplay of these cases, stemming all the way back from what Bryce said about the Jacobson case with the smallpox vaccine and police powers, all the way through COVID vaccine mandates, healthcare decisions for other, family members, and now to Dobbs, where a fetus doesn't have any way of making medical decisions for themselves. I think we're going to have to see how the interplay of all of these different types of decisions are going to affect ultimately the case law with respect to what happens with Dobbs on a state level.
Fortunately, the medical field is rapidly changing. We are constantly seeing breakthroughs in medicine, but with breakthroughs in medicine, it kind of opens the door for renewed debates in the court system and the rights that protect individuals involved. It just so happens that medical treatment to individuals, to children, to mothers, fathers, it's innately tied to an individual's body and choice. So as we progress through the years, next year, the year after, I think we're going to see an influx of renewed debates in the courts, especially with individuals' choice on their bodies and their medical decision making. It's fortunate that we do have breakthroughs in medicine and it does treat and help individuals, but we're going to have to get to that position eventually, and these issues are eventually going to have to be renewed and discussed. And I think you're seeing that now, especially in the Dobbs case. Who knows? We're not fortune tellers of where the courts are going to go with this, but all we can tell from right now is what they've ruled upon through the Jacobson, the COVID, and now we're seeing it in the Dobbs case.
When you talked about some fetus not being able to make a decision for itself, then it makes me think of people in comas. You have to make decisions for them too. It's murky. So when I think about, like, my mother took DES when she was pregnant, so you are making medical decisions for fetuses, So a lot of women my age had serious complications. Some men, but mostly women, had complications from DES. And then some grandchildren had some complications from DES.
That goes without saying, right? Like any
Right.
pregnant woman who seeks treatment for a condition while they're pregnant and gets medication or anything. I mean, down to taking Tylenol during pregnancy is no longer safe. So, that female is taking, risks with the pregnancy by, sometimes you can't just not take anything. And
Mm-hmm. Right.
and I had COVID when I was recently pregnant, and it was one of those things where, okay, what's worse? Is it worse for me to take Tylenol or versus having, 103 fever?
Right. Right.
What is worse?
Yeah. What does all of this mean? Can you kind of sum up? What does this mean when it comes to the government's power in making an individual's health care decisions?
From my perspective, with everything we talked about today and everything that we've discussed in this article, I think medical decision making in the government and in the court system it's going to be an evolutionary process, and it's going to constantly bounce around.
I think what you can see after going over this article and what we've discussed is what we thought we knew as laws that were just in place that were never going to change. We're seeing them change now. And then we see laws that were back in the early 1900s that still apply to this day. After looking at this article, after researching the case law, I think we need to take pride in ourselves on being well informed of the medical issues that are affecting each and every individual. Besides just being attorneys in the field of medicine, I think individuals need to make sure they pay a close attention to community and global health threats, because we've seen time and time again that courts have upheld mandates when it has affected public health risk.
Mm-hmm.
But when it comes to individuals, there may be a little hesitation there because they don't want to medicate from the bench. However, we see now that there has been some changes in that thought process. So I think moving forward, it still is constantly evolving, but we need to just make sure that we are aware of the medical issues that we face and keep well informed on the law, because it's going to change, and we need to be prepared when it does.
Excellent. Okay. Well, Bryce and Sandy, thank you very much for talking with me about this today.
Thanks so much for having us.
That concludes this episode of the Emerging Litigation Podcast. If you have any questions about anything you heard on the podcast or would like to participate, please write to me at editor@litigationconferences.com. The Emerging Litigation Podcast is a co-production of HB Litigation and Critical Legal Content, my companies, and Fast Case, and our friends at Law Street Media, David Nair, Editor-in-Chief. This is also the audio companion to the Journal on Emerging Issues in Litigation, published by Fast Case, Full Court Press. Tom Hagy, Editor-in-Chief, Morgan Wright, Publisher. I'm your host, Tom Hagy. That's why I'm talking, and I don't know if it needs to be said, but this is not legal advice. Unless telling you it's not legal advice is legal advice, although I'd argue it's just plain common sense. Thanks for listening. Give us a rating, share with friends. See you on the next episode.